So we're here today to talk about Care Act advocacy, and I've got some questions for you here, Ellie. So my first question is, what's the referral process for Care Act advocacy?
So referrals for Care Act always come through social workers, or certainly most of the time they will come from a social worker.
Okay, and who's eligible for Care Act advocacy?
So there are three main criteria for Care Act advocacy. The person has to be going through a social care process of some sort. It can be an assessment, it can be a review of their needs, or maybe a safeguarding process. It has to be somebody that has substantial difficulty in engaging with that process. Now what that means is that they might struggle to retain all the information that's being given to them, they might struggle to understand everything that's being said, or they can't quite weigh up all the options that are being made available. And lastly, it has to be a situation where that person doesn't have their own friends and family to support them. So an advocate can step in as somebody independent to support them to understand that process.
Okay, lovely. And what issues do you come across in your work as a Care Act advocate?
Yeah, so obviously the people are going through some kind of assessment or review of their needs, and a lot of it's around supporting people to understand what kind of needs they might have moving forward. So for example, let's say an elderly person might find that they're struggling to live at home independently, and it might be that through a needs assessment they can be supported to get some extra support in their home, or it might be that somebody wants to, I don't know, engage with their local community more, and we can get them to, through that process to maybe attend day centres and do different things. So it's kind of about helping people really to improve their lives through these kind of assessments that they're going through.
Okay. And what are the challenges that advocates face when they're providing Care Act advocacy, and how would you handle these?
Yeah, so there's different challenges. The main one I think that we face as an organisation is that not everybody is aware of the Care Act. It's quite a new piece of legislation. Social workers aren't necessarily aware of how to use the Care Act and how to involve advocates, and definitely people are not aware of the Care Act and how it can affect their rights, and how advocates can support them to have their voice heard and their rights upheld under the Care Act. There's something around the role of the advocate in managing people's expectations. So we do quite a lot of work in explaining to clients and professionals what an advocate can and can't do, and supporting people really to have realistic expectations of the process. So, I don't know, for example, we were saying before, sometimes people want to access day centres, and it might be that the social worker can do that, but it might not be in the area that they wanted it to be. So it's about explaining to clients what advocates can and can't do, and also having realistic expectations of that process.
So Ellie, what are the possible outcomes of the advocacy work?
Yeah, so as part of the outcome, it's really important that there is an accurate assessment of that person's needs. It's really, really important that that person is involved in the process as much as possible. The Care Act says that people that are involved in the Care Act process need to be at the centre of that. We do reviews ideally sort of maybe 6 weeks after that process is finished to make sure that there have been some outcomes from the Care Act process. And one of the things that we always have to bear in mind, professionals as well as advocates and clients, is that the Care Act says that it's about stopping people's needs increasing if possible. So making sure that whatever's being implemented is going to keep people as independent as possible for as long as possible, and living the life that kind of they want to be living.
So if somebody thinks that they're eligible for Care Act advocacy, how can they refer themselves to the service?
Yeah, so there's different things that they can do. It might be that they can speak to their social worker and ask them to be referred in if the client is aware of the service. Sometimes we refer people on to Care Act advocacy if maybe they're engaging with AdvoNet with another service, like maybe community advocacy. They can call our first contact team on our office number, and they will be able to explain to them what the process is as well. And obviously social workers will often make that decision and refer it to us directly.
Okay, thanks Ellie, that's been really helpful.
Thank you, Libby.
The AdvoNet Group are an independent advocacy charity based in Leeds.